The obliques are located right next to the lateral fibers of the quadratus lumborum and often can be reached as well with your sweeping hand along the iliac crest. As I turn the arm and move it just a bit to work with the fibers, and can dip to treat those fibers side to side of the gluteal muscles and other hip rotators. By placing your forearm here, reaching down and lifting the foot and letting it jostle it a moment, just let her know that I want it to be loose. And as I raise that up, it creates more slack to get into those rotators. Use pressure and separation. Can reach the quadratus lumborum very easily right in there. On the opposite side, the forearm can be placed if you don't have to reach over the table too far, or if it's too far to reach the forearm, use your hands. From the ischial tuberosity to the lateral border of the sacrum is the line or the place where the sacrotuberous ligament runs. So in moving the spine, can find it from the coccyx to the ischial tuberosity. It lays right there and can find it very easily with fingers and palpate it in a side-to-side manner, looking for any tightnesses, any adhesions. Alternately, can, depending on the person, reach and pick up the thumb saver and do the same treatment gently along that same line from the ischial tuberosity here right up to the lateral border of sacrum. We can reach under and just gently lean back for a stretch of the lumbar area. If you need to, place both hands. The beveled L-bar places right in the lamina groove, that space between the transverse and the spinous process, for clearing out muscles and ligaments and tendons deep in that groove. So it looks like this. Find the spinous process with your fingers, place the L-bar in the lamina groove, and then holding it gently, work side to side 6 times. 1, 2, 3, 4, 5, 6, and then gently go cross fiber in a scooping fashion 3 times. From the L5 transverse process to the ilium is the iliolumbar ligament. And if we can place the thumb saver in that position just like that, we can usually get down to the iliolumbar ligament and do a treatment. Hip rotations. A knee to chest stretch. Turning and placing the whole leg into a stretch, the whole lower leg, and some gentle rotational movements of the hip by cupping the heel into your hand, the palm of your hand, and guiding with your opposite hand. Don't need to grip, just a gentle hold will usually do it. Proceed to do gentle circles in both directions, gradually getting larger and more pronounced, either to the outside or cross the midline to the inside, ending up in a nice stretch there. Can change hands, place a hand here, and assist her with a nice stretch. Pelvic stabilization, a specific technique to help in limbering up the hip joint and increasing the mobility of the hip joint. And it's done like this. Bring the leg up, allow the leg to be in your hands. That's the first step. Second step, drop the heel. Third step, press on the knee and the heel while bringing the knee across the midline of the body, and then drop the heel and maintain pressure coming back to the starting position. The next one is from Moshe Feldenkrais, the pelvic clock. And for this one, I asked my client to imagine a clock face on the table where up here is 12 o'clock, where you've just pressed is 12 o'clock, your coccyx is 6 o'clock, and this hip bone over here is 3 o'clock, and this hip bone here is 9 o'clock. So first I'll ask you to come to the press at 12 o'clock, good, and then press at 6 o'clock by arching your back, good. Come back to 12 o'clock, press and breathe. And now we'll add in the complete clock by saying, on the way to 6, I want you to stop off at 3 and press down on that hip bone. So follow my hand, if you will, pressing at 12, and then down at 3, and then arching the back to 6, and coming over and pressing down at 9, and then bringing it back to 12. That's very good, just a little slower. Quite often, the original assessment test can become a wonderful stretch. In this case, it's the Thomas test for psoas tightness, becomes the psoas stretch. So I'll ask my client to grab her right knee and hold as I help her to lay back to the table. And she'll bring that right knee in as far as she can to wherever it needs to stop to stretch the left psoas. In addition to the psoas stretch, we want to teach the client the McKenzie back extension, or from yoga, it can be called the cobra. And in that, we would ask the client to be face down with your head here, please. Place your hands beside each of your shoulders, just in that manner, and then clench the buttocks and press the pubis into the table, holding that. That stabilizes the pelvis while you inhale. And upon the exhale, I want you to let your eyes come up the wall. And when it gets to a point where you need to bring in your arms, you add in the arms and let your eyes continue to come up the wall, relaxing your shoulders, and come on up. Come on up as you exhale, and when you are done exhaling and need to inhale, you let yourself go back down.